Thanks for staying with us. The Department of Health has clarified its statement on the wearing of face masks by children at school. The department says the confusion was created in human error yesterday. In a statement yesterday, the department said children did not need to wear a face mask at school. Now, this part of the statement has since then been retracted. Let's speak now to Professor Mignon McCulloch, who is the Chairperson of the South African Pediatric Association. Prof, thank you so much for your time. The department has clarified the confusion because a lot of people didn't know whether or not children will be allowed to wear masks at school or not. But some are still saying, despite this clarification, they do not believe that children should be wearing face masks at all. I'm keen to hear from you. What are your thoughts on that?
Thank you very much for having me on your show. And I think it's about having a flexible approach and about just being sensible and calm. So we know that COVID is with us. It's going to be with us for a long time to come still. And we know that the summer has passed and we're now getting winter again. And so I think it depends on where you are placed. If you are in a very crowded room, very crowded taxi, poor ventilation, lots of people sitting close together, then there are benefits to wearing a mask. If you're a little person under the age of 6, definitely no benefit because you're not going to be able to wear it properly. There's quite a lot of controversy about what happens to those kids sort of 6 to 11. And the older children or the teenagers or the young adults, as we will call them, would probably benefit in the same way as adults do. So if a mask is worn properly in a poorly ventilated area, there are definitely some benefits to wearing a mask and not spreading the infection. It also depends on whether you go home to a vulnerable family member. So if you've got somebody who's elderly, somebody who's got a chronic illness, or in fact, if you have a chronic illness, then I think there are definitely benefits to wearing a mask as well. And so I think we need to just be sensible about it. Healthcare professionals have worn masks for many, many years. Surgeons have worn masks for many, many years. And I think we need to just take that middle road and look at whether we are dealing with a vulnerable population. Are your family members vaccinated? So we know also if you are vaccinated, if the teenagers are vaccinated, there's less chance of acquiring the virus, but also less chance of getting a severe situation where you may end up in hospital. We know that new variants are much more contagious than they were right in the beginning. And so I think we just need to just be calm and measured and look at the pros and cons of the situation and each individual child.
And Prof, talking about, being calm and being flexible, there was also some who were saying that, for little people, it will be important to have what they call face mask breaks. They're saying that at school, for example, around 5 to 15 minutes for every 2 hours during the school day, where maybe they just take them outside, they remove their masks, and then they come back into an indoor area. I wonder, looking at the surge in numbers, is this still a good idea?
Yeah, so I'm not sure that there's very robust evidence that shows that this really is the situation. But I think anybody who's worn a mask, having a break, and going out in the fresh air is really a good idea, but there's no evidence showing that there are definitely benefits with that. I think if it's raining outside, forcing a child to go and stand in the rain for 15 minutes with their mask off may also not be such a good idea. So it is just about being sensible. Little guys struggle to wear a mask properly. I think we all agree with that. I think the bigger concern would be those high school learners and university learners who would behave much more like adults, especially those patients that may be vulnerable. So we work at a big children's hospital. A lot of our patients do go to school. And I think in a patient who, or a pupil or learner who is vulnerable, it may be a good idea for them to wear a mask as well. But I think the whole situation where it's an absolute yes or an absolute no, I think there's a lot of debate about that. And I can understand why people are feeling anxious about the situation.
And Prof, when we look at the fact that, when the first statement by the department came out to say that, those learners in school may not necessarily need to wear masks, and then now this move to further clarify, some people say that this is not helping at all because there are individuals that are panicking about the numbers that are going up. So how important is communication still at this particular point in order to ensure that there's no further confusion?
So you've hit the nail on the head. I think communication in any situation is really important. It's also the situation. So if it's a sunny day and the learners can go outside, they can take a good break, they can run around outside, that's obviously a great situation. If you've got 50 or 60 learners in a poorly ventilated classroom, somebody is actually coughing, some of them are sick, not necessarily from COVID, but possibly all the other winter viruses that we are now beginning to see as well. Then you would need to say, well, possibly a mask would be of benefit to that group of learners. Similarly, if you're sitting right on top of each other in a taxi, I don't think we've ever had definite yes or no about being in a taxi, but I think that situation would make sense. It's about being logical. It's just about trying to prevent spread of this condition as far as we can. Summer was easy. We were all running around outside. Winter, a little bit more difficult, especially if you've got poor ventilation. So I think we know it is a highly transmittable variant. Hopefully a lot of our population have either had the vaccine or have already had some exposure to COVID or have had it themselves, although we know that the new variants are coming up all the time and that they are very contagious. So
Prof, pardon me for coming in there. In December last year, we heard from the Chris Hani Baragwanath Hospital saying that the COVID-19 patients were getting younger and they were concerned about that particular situation. I wonder, with the numbers going up now, what does the picture look like?
So we've always had, with the newer variants, the Omicron, we have had lots of younger patients, even babies as young as a month of age, have come in and they have tested COVID positive. But as with some children, if you fall off a bicycle, you break your arm, you need to go to theatre, you get tested, you are COVID positive, but you've got no symptoms. So we've been seeing quite a lot of that. In addition to that, we're also seeing a lot of the common respiratory viruses, such as adenovirus, rhinovirus, metapneumovirus. So we're seeing a lot of viruses that we haven't seen for a while because people have been shielding their children. They've also been wearing masks. So there are benefits in wearing masks and not getting the other winter viruses as well. So difficult situation. I can understand why everybody's up in arms, but I think we just need to be logical and have a flexible approach and take it case by case. I think for older children, older learners who behave more like adults, we probably need to be wearing masks. For the younger ones, I think we can have discussions about what works. If you've got a well-ventilated class, big distances between the kids, nice day, they can run outside, and you don't have lots of children coughing ill, that works well.
Prof, thank you so much for your insights there. Do appreciate them. That was Professor Mignon McCulloch. She's the chair of the South African Pediatric Association.